السلام عليكم يا شباب. Time to start working. I would like to remind you that time is money. We have to spend it very wisely. Quiet, please. And if we want to work smarter, not harder, we must organize our time. Now, working smarter makes lots of difference. One person is pushing the weight with a finger because he is working smart, and the other one is sweating and working very hard. That's the difference. Why shouldn't we use our intelligence to work smarter, not harder? So keep calm and study smart. If you are not concerned about your future, you are not willing to listen, you are not willing to ask, you are not willing to see anything, okay? And you are supposed to open the door of your mind to receive anything concerning your future, or you are closing the door. Anything happens in the university is not my concern. Let me go home and memorize. This is the policy of many students. Why should I spend 1 hour extra in the university? Let me go home and study. That is suicide. So if you describe yourself as A, then you stay. Open the door of your mind and receive anything you can. If you describe yourself as such, you can leave. Once the absence and the presence is taken, please leave if you want to, okay? Now we are supposed to study the external ear to prepare ourselves for the future. We're going to see lots of people complaining of problems in the ear. If you go to the ear, throat, and nose clinic, you see lots of people are queuing to see the doctor, and you will be there one day. So let's be prepared for the future. You should always think about the future. So again, if you don't want to see any image or hear anything or ask, please leave. And remember, do not miss analysis, discussion, and sharing information. These are 3 very important factors for success. And success starts here. Collecting data alone is not good enough. We have to process it. Car accidents produce lots of injuries. One of them is tearing off the external ear, the pinna of the ear. Now, this person has to be cleaned first, and then we have to restore the shape of the pinna. If the pinna is disfigured, then he's going to curse you, because people are usually concerned about the way they look. Another problem is the cotton buds. The cotton buds are dangerous because people, they don't know how much they should push it in. The external auditory meatus is around 2.5 centimeters. They think they are clearing the wax out of the external meatus. Now, the wax there is physiological. It is there to pick up dust and foreign materials. And when it does its job, it comes out and dries. So you just clean what comes out. When you put this cotton bud, you are pushing the wax in. Now, day after day after day, the external auditory canal will be blocked. So that is a very common problem. Perforation of the tympanic membrane. The external ear also develops from several points, and some babies are born with disfigurement of the external ear. This ear has to be corrected, and to be corrected, we need to know what are the features of the pinna of the ear. Here is a very mild congenital abnormality in which there is a hole. The ear has developed, the external ear has developed 99.9%, and this hole is the 1% remaining. Here is a pinna of the ear after an accident which was very badly repaired, which has to be repaired again by adding a plastic appliance. That can be bought in the market. Here is a very important image. Blood coming from the external ear is a very dangerous problem. Very dangerous problem. It may indicate fracture of the base of the skull. So if you receive a patient of blood coming out of the external ear, you should take very good care. You should investigate very well, because it may indicate, I'm saying it may, not always, it may indicate fracture of the base of the skull. Some people will come to you with insects stuck in the external auditory meatus. Now, this insect has to come out. Now, in order you can put a forceps to pick it up, you should know how long is the external auditory meatus and whether it is straight or not. This is something we are going to address. If you don't know the curves of the external auditory meatus, you will injure the external auditory meatus, and very bad inflammation is going to result. If the inflammation lasts for some time, there will be constriction of the external auditory meatus. This is taking wax. When the wax is being pushed in day after day after day, the person is not going to hear very well on that side. So the doctor has to pick up the wax out of the external auditory meatus. Pus coming out of the external auditory meatus. This is also very serious because it is likely to come from the middle ear. Middle ear inflamed is termed as otitis media, inflammation of the middle ear. Very dangerous sign. Inflammation of the middle ear is very dangerous because it will lead to probably loss of hearing and facial paralysis. Cancer around the pinna of the ear is also encountered as well. It's very important. You should examine the draining lymph nodes. Therefore, we need to study what lymph nodes drain the external ear. Tumors of the external ear as well. Inflammation of the whole pinna, of the whole cartilage of the external ear is also a problem. Little abscess in the wall of the external auditory meatus. This abscess is going to be very painful because the skin is very well attached to the underlying bone. And when the pus collects, the pressure is going to be high. Therefore, the patient is complaining of severe pain. This is bad external auditory meatus and bad tympanic membrane. This is a tumor, an osteoma of the wall of the external auditory meatus. All these conditions require us to know at least very basic information about the external ear. The tympanic membrane. Tympanic membrane has its own problems. We will be coming to see them very soon. This is very inflamed tympanic membrane. There is a cone of light. We will be talking about this shortly. See lots of blood vessels. Here is a perforation of the tympanic membrane. Tympanic membrane should vibrate so that hearing process is going on normally. If it is perforated, it is not going to vibrate. All sorts of tympanic membrane perforations. Here is the whole tympanic membrane being lost. Now, the patient should not come to this stage because it should be treated very early. Huge tympanic membrane perforation. Some people will come to you and say, I would like to have a plastic operation on my ear so that my ear looks like this. Some people say, I want to put this cigarette lighter in my external ear. So what are the features of the pinna of the ear? There are elevations and depressions. The elevations are, this outer curved line is called the helix, continues all around. And there is an inner elevation called antihelix. This antihelix has two extensions, the superior crus and the inferior crus. Then we have the tragus, and then of course the antitragus, and then the lobule. These are the elevations of the external ear. This is a living image of a person showing the external ear. Here's the helix coming all around the eye, the pinna of the ear, and here is the antihelix, the inside elevation. Here's the superior crus, and here is the inferior crus, and between the superior and inferior crus we have a fossa, a depression. Then we have the antitragus, the notch between the tragus and the antitragus, and then the lobule. So we have to have some knowledge of these features so that we can reconstruct the ear. Then there is a cave that will lead to the external auditory meatus. Now, this is how the external auditory meatus is examined by an otoscope. Because the external auditory meatus is not straight, in an adult person, we need to straighten it up so that we can see the tympanic membrane. We straighten it up by pulling the pinna of the ear or the external ear up and posterior so that it can be straightened and we can see the tympanic membrane. And this is what we see when we put the otoscope before pushing it so that we can see the tympanic membrane. We see hair to trap foreign materials. And this is the normal tympanic membrane, the end of the external auditory meatus, separating it from the middle ear. Now, on the right tympanic membrane, there is a cone of light. This is the normal appearance, a cone of light. It is at 5 o'clock. If you consider the tympanic membrane as a circle or a clock, it is at 5 o'clock. If you go to the left ear, the cone of light is at 7 o'clock. Shiny, whitish cone of light. These are normal tympanic membrane. Tympanic membrane is thin. بس اللي بده يطلع يطلع. هسه حكينا شو يعني شو القصة؟ One day I will invite the dean to stay outside the room and see how many students are leaving. This is a normal tympanic membrane. Tympanic membrane has a thick circumference. Okay, this is the annulus. The question is, are all parts of the tympanic membrane tense like a drum? The answer is no. Most of it is tense. It's called pars tensa. And there's part of it is flaccid. It's called pars flaccida. And the pars flaccida has an anterior fold and a posterior fold. It is on the superior part of the tympanic membrane. And what makes the tympanic membrane tense is that a bone, one of the ossicles, is attached nearly to the middle of the tympanic membrane from the middle ear and pushes it in. So it is not a straight like piece of paper. No, it is pulled in the middle to the inside of the middle ear by the handle of malleus. This depression is called umbu. When we examine the tympanic membrane, we need to check all these areas. And here's the cone of light. Is this the right or the left? Because the cone of light is at 5 o'clock. Again, this is a normal tympanic membrane. Tympanic membrane is around 1 centimeter in diameter, and it's made of 3 layers. Ectoderm on the outside, endoderm on the inside, and very thin connective tissue in between. So let's go to the CT scan, the real life, and let us see the external auditory meatus so that we can understand that it is not straight. It looks a little bit posterior, right? So if you want to put an horoscope, put it slightly anterior so that you can see this part. Again, this is a CT scan. You know, the external part of the external auditory meatus and the middle and the inner ear are in the petrous part of the temporal bone. Now, the innermost part is in this direction, then it turns in this direction and then looks posterior. So it is called sinuous, like an S that is stretched. Therefore, when we want to examine the external auditory canal and we want to see the tympanic membrane, we have to straighten this sinuous structure. We will be able to do that because part of it is cartilaginous and part of it is bone. Again, let's look at this CT scan of the petrous part of the temporal bone. The structure between the two arrows is the tympanic membrane. So the tympanic membrane looks forward. That's the tympanic membrane. This is what you see, the tympanic membrane in CT scans. Now, if you look at this CT scan of a patient that comes with a problem in the ear. Now, on the right side, that's the left side, you can see the external auditory canal, you can see the tympanic membrane, and you can see the middle ear. That's the external auditory canal, this is the tympanic membrane, and this arrow indicating the middle ear cavity. See, the middle ear cavity is so small. Now, if you look on the other side, you can see that it is filled with fluid, which is the disease part. Now, we cannot see that by physical examination. It is only by the CT scan that will tell us where is the problem. And the bone is eroded. You can see that the bone of the petrous part of the temporal bone is not smooth. It's not straight or curved lines. And here's the pus collection. That's the middle ear cavity. Here is an image of the external auditory meatus blocked medially by the tympanic membrane. Tympanic membrane is sitting in a groove, as you can see. It's sitting in a groove, and it separates the external auditory meatus from the middle ear. And here is the groove. If we look at the external auditory meatus in a skull, and you can see that this probe is pointing posteriorly and inferiorly. Now, if we put an otoscope, it has to go what? It has to go anteriorly and superiorly. Meaning that the external auditory meatus, if it looks this way, we put the otoscope this way. Students get confused when they read the book. When I read the book, I should ask myself, is the book describing the direction of the external auditory meatus, or is it describing the way I put the otoscope? So that's the direction of the external auditory canal, and this is the direction that I put the otoscope to see the tympanic membrane. The external auditory canal is made of cartilaginous part and bony part. The bony part is made by tympanic plate of temporal bone. That's the tympanic part of temporal bone. This image is showing me that there are intrinsic and extrinsic muscles of the external pinna of the ear, which are vestigial in man. In the humans, they are very rudimentary and neglected. Now, you know your way in this image. This is the mastoid process, and this is the bony part of the external auditory meatus. Here is the tympanic membrane, and here is the facial nerve. We will be talking about that in a future lecture. This facial nerve is going to supply some area in the skin behind the ear, because the impression you have is that the facial nerve is totally motor. It is not. So that's the facial nerve. And here's the area of skin supplied by the facial nerve for common sensations. As if you put your tip of finger behind your ear lobule. This is supplied by the facial nerve. Now, nerve supply of the pinna of the ear and the external auditory meatus is coming from multiple nerves. This area here is supplied by fascia. This part here is supplied by the vagus. Part of the tympanic membrane and part of the floor of the external auditory meatus is supplied by the vagus. This is very important because you know the vagus supplies so many structures. One of these structures is the heart. The other is sensory supply to the bronchial tree. So some people, when they fiddle with the cotton bud, they cough because of the stimulation of the vagus. Don't stimulate the vagus because it may cause bradycardia and sudden death. Then the auriculotemporal nerve, the lesser occipital and the greater auricular parts of the cervical plexus. They overlap. There is no very exact map of nerves supplying the pinna of the ear. But take care of the auricular branch of the vagus. Why should we take care about the vagus? Because overstimulation can lead to vasovagal attack. And you know what is vasovagal attack? It's stoppage of the heart beating. The pinna of the ear and the external auditory meatus is richly supplied with blood vessels and lymph nodes, because inflammations that will take place in the pinna of the ear or external auditory meatus, if they get extensive, they drain to different parts of lymph nodes, especially the carotid ones, the posterior auricular, and then they end up usually in superficial cervical lymph nodes. So that's the external ear. these are the things that we need to study for the external air. When we come to the middle ear, the middle ear is a nasty structure because it is small, it is closed by the tympanic membrane. We cannot see what is happening in it, and it is connected to the nasopharynx. And it is common in children. Why I am presenting you with this image is because the baby cries all the time, cannot sleep, and this is what he does. He pulls his ears. This is an indication that there is something wrong with the middle ear. This is a classic picture. Babies who cry a lot, feverish, and they stop feeding, and you examine them, and you cannot find anything wrong with this baby. Then you should go and blame the middle ear. Pus coming from the external ear is very likely coming from the middle ear with the tympanic membrane perforated. Blood coming out of the external ear is a very dangerous sign, and it's likely to come from the middle ear. Problems of the ear, the external and the middle, are very painful. They prevent people from sleep. And when they come to you and say, I did not sleep last night, you should believe them, because these diseases are very painful. It's a problem. So what's happening and where is the disease? Now, the story is going to start here. Nasopharynx. Large tonsils blocking the opening of the Stapedius tube. Very large tonsils. That's the opening into the nasopharynx, and microbes get into the middle ear through the Stapedius tube. So the Stapedius tube is a way of getting the infection into the middle ear. The Stapedius tube is partly bony and partly cartilage. It is connected to the nasopharynx. If you look at this image and you see the back of the nose, if this is the nose, okay, this is the nose. If you look at the back of the nose, this is the base of the skull, is big whitish area. This is the pharyngeal tonsil. If the pharyngeal tonsil gets inflamed and large, then it's going to block the opening of the Stapedius tube. When the middle ear is infected, there will be exudate, fluid, serous fluid or pus. So that's the normal, and that's called otitis media. If you look at this CT scan, now, when a patient comes to us, we do not know if this patient is collecting fluid or pus in the middle ear. We cannot know. Probably we look at the tympanic membrane and we see it's not transparent anymore. The cone of light is blurred, but the evidence comes through the CT scan. If you compare these two images, you can see that this is a normal filled with air, and this is not normal filled with opaque material. So this patient has collection of fluid or pus in the middle ear. Again, this arrow is pointing at the tympanic membrane, and deep to the tympanic membrane you can see that there is some sort of collection in the middle ear. Now, the middle ear has not only connection to the nasopharynx. This Eustachian tube, on the side of the Eustachian tube, there is also a canal for a muscle called tensor tympani. So that's the Eustachian tube. The yellow arrows indicating the bony part, and the green arrow indicating the cartilaginous part. And you know, this is the sphenoid air sinus. Sorry, and this is the opening of the Eustachian tube. Cannot see that except in CT scans. Now this is a picture of a normal tympanic membrane. Again, that's the flaccid part and the tense part. Here is the light of the cone. Here is an inflamed tympanic membrane, probably indicating something wrong in the middle ear. Here is a bulging tympanic membrane, indicating that there is serious process going on in the middle ear. Here's the tympanic membrane lost, and we can see different structures of the middle ear. Pus coming out. Now, why did I put this image? Because the patient comes and tells you that I have pain behind my eye. Okay? That's the eye, and the middle ear is posterior to the eye. Now we know that the middle ear is in the petrous part of the temporal bone. Its shape is biconcave lens, and it is filled with air because connected to the nasopharynx, and it is an extension of the nasopharynx. Here's a CT scan of the temporal bone showing you the middle ear cavity. It has a roof, floor, anterior wall, posterior wall, and medial and lateral. Let's see this image. Where is this image? This image is in the temporal bone, where it is cut to show the middle ear cavity. Now, the anterior wall is made of what? It's made of this tunnel, bony tunnel, that has a muscle inside it, and this muscle gets out and attaches to the malleus. Therefore, it is called tensor tympani. Inferior to the tunnel of tensor tympani, we have the Eustachian tube that opens into the nasopharynx. And then inferior to the Eustachian tube, we have the internal carotid artery. When there is hyperdynamic circulation and blood flows into this artery in a way that produces turbulence, there is going to be bony conduction of the turbulence. Therefore, some people with hypertension, they tell you that they have what? They have طنين في الأذن. Okay, because the internal carotid artery is so near to the middle ear. If you look at the floor is made of thin bone, and it is the bulb of the internal jugular vein is very nearby. If you look at the posterior wall has the following features. At the top of it, there is a big hole called the Auditory, which opens into the mastoid air cells. And then we have the mastoid process full of mastoid air cells. And then we have the facial canal that runs into a canal in the mastoid process. And then there is another muscle similar to the tensor tympani. This muscle is cone-shaped, and the muscle is inside the bone, and only its tendon appears and attaches to the stapes, and therefore it is called the Stapedius. This nerve is called Tympani. We'll be talking about this later on. Facial nerve is coming out of the mastoid process at the stylomastoid foramen. The roof is thin bone called tegmen tympani. Severe infection of the middle ear can affect the facial nerve and leads to facial paralysis. And this thin bone, if it is eroded with severe infection, it will extend into the middle cranial fossa and leading to brain abscess. So middle ear infection is a very serious problem. The medial wall is made of posteriorly a turn of transverse or horizontal semicircular canal, the facial canal, the oval window, the rounded window, and promontory, the base of the turn of the cochlea of the inner ear. Tympanic membrane makes the part of the lateral wall of the middle ear. That's the tympanic membrane with the malleus attaching its handle to the middle, producing a depression. And here is the tensor tympani in a bony tunnel, attaches to the malleus. And here is the cone of bone having a muscle, and the tendon of the muscle is attached to the stapedius, therefore, to the stapes, therefore this is the stapedius muscle. That's the round window. And here is stapedius muscle. Strange things happening in the middle ear. Here's the tympanic membrane. Here's the bulb of the jugular vein. And here is the internal carotid artery. And you can see that this is the middle ear cavity, like a biconcave lens. These are the ossicles, the three bony structures in the middle of the ear. They are connected by synovial membranes with a synovial cavity, articular cartilage, and everything of synovial membrane. That's the carotid artery and jugular bulb. Here's the external auditory meatus. Here is the temporal mandibular joint, and it is anterior to it. So people having problems with the temporal mandibular joint, they may come and say, I have pain in the ear. Jugular vein and carotid artery, and this is the stake tube. Facial nerve is in direct relation with the walls of the medial wall and the posterior wall of the middle ear. Severe infections can lead to problems of the facial nerve. That's the tympanic membrane. That's the beginning of Stake tube, and this is the tensor tympani muscle. This is the medial wall, parts of the concha, the basal turn. This is the stapedius muscle. If you look at this structure here, you can see that it is a cone of bone with a muscle, and the tendon is coming out of the tip of the cone. Here's the stapedius. Okay. نعم. يلا يعطيك العافية.
ينزل البلد من الاير معناها بيكون